This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar. This seminar is...
Hi and welcome. Thank you for joining us today for our HealthyU webinar series on Mather Hospital's comprehensive medical weight management program. Please enter any questions you may have using the Q&A feature you can find at the bottom of your screen. We'll answer as many questions as we can with the time allotted towards the end of the presentation. I'd like to introduce you to our two presenters today. Barbara Brogglesworth is a registered dietitian nutritionist currently working with bariatric and medical weight management patients. She works with patients to help them achieve their health and weight loss goals. And Daphne Baldwin-Cornrich is also a registered dietitian nutritionist and has been for the past 30 years, working in a wide variety of clinical and outpatient settings. Daphne currently specializes in bariatrics and weight management. And Barbara will be going first. So Barbara, take it away.
Oh, here we go. Thank you. Welcome, everyone, and thank you for taking the time to learn about our program here at Mather. Next slide. Okay, so we're addressing a need here, right? In 2011, the National Institute of Health came up with a strategic plan for all Americans to address research and collaborate research around the concern over obesity. And so they've been collecting these statistics. I wanted to share a few with you. So what did they find? Well, we know now that half of all American adults have one or more preventable diet-related chronic disease. We know that obesity is highest among middle-aged and older adults. We know that more than 2 in 3 adults are overweight or obese, and only 3 to 5% of adults are meeting exercise recommendations. But it's not our fault. It's not our fault. Our society is making us unhealthy. You know, so as we look back, our ancestors never worried about their thyroid, their gut, heart disease, cancer. They didn't worry about those kinds of issues. So what's changed? Well, we're working more hours. And not only are we working more hours, but in our households today, we've got both parents that are working more hours. And if you have children and those children are in school, pre-pandemic, you had all of these extracurricular activities that you had to drive them to, right? We're in a hyper-competitive society. We want everybody to have a leg up. So it's sports and, you know, tutoring and you name it. Then you come home and you have homework. And on top of that, you have to meal prep. So it's a lot. And we understand that. We also know that as a society, we're more isolated, right? Even before the pandemic, technology and social media was isolating us. And we can't rule out the fact that there's a lot of conflicting advice on nutrition. I can't tell you how many people are asking me about apple cider vinegar for weight loss and so many other things and so many fad diets that are out there. And last, we're heavily marketed to overconsume highly processed foods. So, but we do understand that weight gain is multifactorial, right? So it's a confluence of many, many factors. We just talked about environmental and lifestyle, but did you know there's a genetic factor? There's actually an obesity gene that's being researched right now. And, you know, we all know families where you have one sibling that looks at food and they gain weight immediately, and you have, you know, the other sibling that can eat whatever they want. So there's a genetic component to this, and we can't ignore that. It doesn't mean that because somebody is predisposed genetically to develop obesity that's a given that they're going to. It just means that they may have to work a lot harder, right? They may have to eat more nutrient-dense foods more consistently. So it's a physiological component. We also know there's a behavioral component. Food is comfort. And in our culture, that's how we comfort one another, right? So, if that is your coping mechanism for stress, then that's something that has to be addressed as well. So we can't ignore there's a behavioral component to it. And then there's a lot of talk about gut health, so who would have thought gut health and our microbiome can contribute to weight gain, but it can. And guess what? All those processed foods can create something called gut dysbiosis. It can create an unhealthy environment in the bacteria in our gut, and that can lead to weight gain. Next, medications. Go back, Stu. We're going to talk about medication. So a lot of people are on medications for many, many different reasons. And a very common side effect of medications across the board is weight gain. So it's something that we have to account for so we can meet our patients where they are. And then injuries that limit physical activity. I can't tell you how many patients come through here that were super active before, but then they were in some kind of catastrophic accident that limits their physical activity, and they didn't have the wherewithal to change or adjust their diet to account for that less physical activity that they were able to perform. Okay, now next. So I want to take a second here because I want to talk about the vocabulary that we use, because you see a word like hypercaloric or hyperpalatable, right? We're very, very careful in how we describe food here. And we do that for a very specific reason. We will never use words like unhealthy or bad or good, because all of those carry with it some kind of judgment. And there's no judgment in this program. We try to be as objective as possible. So a food is either hypercaloric or it's not. It's hyperpalatable or it's not. And that's how we address things. Ultra-processed foods lead to overeating and weight gain because they're hyperpalatable, right? What does hyperpalatable mean? It means that it contains large quantities of just the right amount of sugar, salt, and saturated fat to hijack our taste buds, right? They appeal to the reward center of our brain, and they promote overconsumption, and they are manufactured to do that. And they're available anytime, anywhere. Nowadays you could get Uber Eats from McDonald's. You don't even have to go to the drive-thru anymore, right? You can't go into 7-Eleven to get an innocent cup of coffee without walking by the Dunkin' Donuts rack, and then they have the Tate's cookies splayed out. And before you know it, you're walking out with a bag of Tate's cookies, and you weren't even thinking about Tate's cookies when you walked in there to get a cup of coffee, right? So it's ubiquitous. We have to help our patients learn to identify that so they stop blaming themselves and help them to build strategies so they can navigate this world of ubiquitous food supply, right? We also know that research shows that people tend to eat processed food faster, and they overconsume an additional 500 calories. So let's look at that for a second. What does 500 calories look like? Let's take a piece of chocolate cake, right? A piece of chocolate cake is equivalent to 500 calories. Now, on the other hand, take 5 apples, the equivalent, let's say, of 500 calories, and ask yourself, can you eat 5 apples in one sitting? Probably not. You'd probably get a bellyache, right? There's a lot of fiber, there's a lot of water content, there's a lot of volume, right? We weren't designed to eat that much in one setting. But if you're like me, you could eat that piece of chocolate cake and then another piece of chocolate cake, right? Because it tastes so good. That was just an additional 1,000 calories that we didn't count for, and it gave us no nutrients whatsoever. So it's very easy to overconsume those foods because they don't take up a lot of room in our belly. They don't keep us full for a long period of time, and they don't offer us a lot of nutrition. Okay, so medical complications of obesity. We all kind of know this, but we know that it can lead to stroke and heart disease, cancer. It causes inflammation in the body. We know it can lead to non-alcoholic fatty liver disease, pulmonary disease. That's the bad news. But here's the good news. You don't have to lose a lot of weight to be effective. Let's take some of these conditions, right? Let's look at diabetes. If you can lose 5 to 10% of your body weight, you will lower your risk of developing diabetes by 58%. 58%. If you're pre-diabetic or diabetic, then losing 5 to 10% of your body weight can help improve your blood sugar numbers, right? Not a whole lot. Now let's look at heart health. Losing just 10 pounds can help to manage high blood pressure, right? We know that weight loss reduces the strain on our heart, that being overweight puts an extra strain on our heart, and it increases the risk for developing things like high blood pressure because it can damage our blood vessels. But if we lose 10 pounds, that can help to manage that. It makes it a little bit more attainable. And then let's look at bone and joint health. Research shows that losing just 10 pounds would relieve 40 pounds of pressure from our knees, right? That's pretty powerful. All right, so now I'm going to turn it over to Daphne. Daphne's our program facilitator, and she's going to talk about all the guts of the program. So Daphne, it's all yours.
Okay. Thank you, Barbara, and thank you for everyone that's joined this webinar. Okay, so I'm going to give an overview of our program, and I'm going to start with what we are not. We're not about rapid weight loss. We're not about eating the same thing every day. We're not about avoiding any essential food group, and we're not about rigid menus. What we are is a medically supervised weight loss program that's a joint effort between the healthcare professionals, but most importantly, our patients. Our goals are to provide safe, effective weight loss with medical supervision and provide the skills through education in our program to give you the skills to be in control of your own food environment and not the food being in control of you. We really want to improve the quality of life and also to help those conditions that Barbara alluded to earlier that can be changed with a certain amount of weight loss, such as diabetes, hypertension, inflammation. Our vision. We started our medical weight management program in 2014, and we are so proud that we've had 700 patients come through our programs. And we have helped them lose weight, but more importantly, we have provided the skills and education to have them sustain the weight loss by behavior change. We use the Mediterranean meal plan as our guideline when we come up with nutrition plans because there's 50 years of research, evidence-based regarding the Mediterranean meal plan, which really incorporates lean protein, healthy fats, whole foods like Barbara was just speaking to, staying away from the processed food, lots of vegetables, fruit, fiber, all important essential elements. We also follow the National Weight Registry, the National Institute of Health and Academy of Nutrition and Dietetics guidelines for weight loss. So we really focus on evidence-based when we provide education. Since we are a medically supervised program, we have a target audience, and our target population, I should say population, is someone that has a BMI over 30 with or without comorbidities, or someone with a BMI of 27 to 30 with comorbidities. So just to backtrack, what does BMI mean? That's our body mass index, and it's a way to determine body fat. And usually it's a simple equation where we take someone's body weight and height, and there's other factors involved that give us a number to see if someone's in a healthy range with their BMI. When we talk about comorbidities, it's actually having another disease state or another health issue combined with another one. Say, for instance, if you're overweight and you also have diabetes, that would be a comorbidity with being overweight. Okay, next slide, please. Okay, so our goal is to provide personalized weight loss. So on average, most of our patients lose between 7 to 10% during that 3-month period of our program. At the initial visits, all patients will have a comprehensive exam with the physician and assessment with the registered dietitian. We collect the following information: your height, your weight, your nutrition history, the doctor will go over medication, intensive blood work. We look at comprehensive metabolic panels, lipid panels, your past medical history to really provide the individualized plan when it comes to eating and health that you need. And all these factors are so important because we want to make sure that it is safe. Next slide, please. So our program consists of 10 consecutive classes that that focus on behavior change, healthy eating, activity. And if someone is interested in weight loss medication and the physician deems that it's appropriate, there is the option for medication. We have group classes to help that behavior change. We use cognitive behavior modalities, but basically what we really focus on are those small changes. Everything doesn't have to happen all at once, but making those small behavior changes and building up to more permanent ones are very essential to lifelong weight loss and maintenance. So it could be something as easy as walking 5 extra minutes a day or not having that one extra glass of soda. Those changes really add up and make those permanent lifestyle changes. We have weekly weigh-ins. Now that our classes are virtual, we ask that if you can send your weight via an email, and everything is HIPAA compliant, so no one knows all your information. Just to backtrack, Barbara is our wonderful leader of the classes. And again, to remember that what makes us different is that we are registered dietitian, and we're also specialists in behavior change. We also have that certification. So we are really getting people with a lot of knowledge teaching you in the classes. Again, we also send weekly emails with our education materials. So before the class, you can look at it. You'll have handouts. So we're really excited about that. And again, the class is nutrition, education, self-monitoring, behavior change, social support. That's a really big thing. And I also want to talk, when we talk about the weigh-ins, we're not just about weight. That doesn't define you, the weight. We also discussed before the class some of the non-scale victories, which have to do with not what you weigh on the scale. It could be, again, what I said earlier, it could be making those small changes, having another serving of vegetable, having the one piece of cake, not the second piece of cake. All those things are non-scale victories, and we really do focus on that also. Next slide, please. So we have a rotating class schedule. So your first class could be someone's 5th class. So the classes that are included really focus on, I'm going to go through it quickly: success habit, goal setting, exercise, activity, triggers, mindful eating, food labels like Barbara was talking about, really being able to understand the food that we're putting in our body. Sometimes just learning to read that food label. Is there too much sodium? Is there too much sugar? Is there too much fat? It really is crucial for us making the best decisions. And also with the portion distortion over the last few decades, it's out of control. So we really focus on that. Reason to season, that's a really fun class where we can take recipes that we love and just making a few little changes to the ingredients, we can shave off 100 or 200 calories and really enjoy our food, because we want you to enjoy your food. We don't want you to feel miserable with what you're eating. There's also one on dining out and alcohol. And again, we don't want you to be sequestered at home. We want you to live your life, but we want to give you the tools through the education and the classes that you are able to make the best decisions for yourself. Or maybe you make a decision that maybe you don't think is the best, but you are mindful about it. So this is what our goal is, to give you the tools to make those lifelong changes. And also the last class, bite. Thank you, Stu, it's fine. At the end of the program, you also will have a follow-up with the registered dietitian, myself or Barbara. You will also see the physician to see how you did throughout the program. We also do a metabolic analysis, which I will go into more depth with the next slide, I believe. And we talk about our maintenance program that we have, which I'll also go over. Okay, so our maintenance program. Maintaining weight loss is generally harder than losing weight. So when you join our program and you do the 10 weeks of classes and your initial consult and your follow-up, that's about 3 months. That's only not a lot of time for a lot of people to meet their goals. So we are so lucky that we have this additional program after the program, if you choose to do it, of maintenance, which is so important. It consists of 8 classes over 16 weeks. So it gives you another 4-month window, and it's $80. And these classes kind of build on all the education that you learned with the 10 weeks of classes. We put a different spin to keep it interesting, but it really helps with accountability and really helps people to really get into that mode of this is a lifestyle change. I can do this. I've done it. And we've had people join our maintenance program 5 times, 6 times, 7 times. They love our program, I have to say. And we love the people that we see. We're very, very fortunate that everyone that comes to our program, me and Barbara say all the time, they're so nice, so kind, and very supportive to each other, which is lovely. Next one. So for the MWM program, there's a $220 out-of-pocket fee, and that includes the nutrition assessment. It includes the 10 consecutive classes, the nutrition follow-up, and the metabolic analysis at the end of the program. It sounds like a lot for a lump sum, but if you divide it with everything that you get, it's very reasonable. So the metabolic analysis. So this is a very objective way and a gold standard of measuring how many calories our body burns while at rest, with exercise, daily activity. So after you complete your program, we do this metabolic analysis. And again, it's going to measure the oxygen and carbon dioxide exchange, a process called indirect calorimetry. I hope I said that properly. And this gives us more objective data to come up with some target goals. Like if you want to know how many calories you need to lose more pounds, how many calories you burn with exercise, how many calories you burn just with daily activity, and also about your metabolism. Is it normal? Is it slow? Is it high? And what can I do? So I have a slow metabolism. You know what we could recommend? Maybe you need to do some weight or strength training exercises so you could increase your metabolism. So it's a very, very informative test. Next slide. And you will get a printout that goes through everything I just went over. So it's very informative. Next slide. Thank you. So again, I just want to also tell you that everybody is treated individually. If you ever needed something more, we're always available, a phone call away. If you had to come in, because the classes are for everybody in the program, but we're always available for that individual that really needs extra, some extra TLC, so to speak. Thank you very much.
Great, and thank you, Daphne. Thank you, Barbara, for a very informative presentation. If anyone has any questions, you can enter them now in the Q&A feature at the bottom of your screen. If for any reason we don't get to your question, you could also email us your question at matherhospital, one word, matherhospital@northwell.edu, and we will forward it on to Barbara and Daphne. Once you exit the webinar, you'll see a link pop up to complete a survey. It's a very short survey, and we value your feedback to help us keep improving these webinars each time. Thank you again for virtually attending Mather Hospital's HealthyU webinar series. And we have a few questions. Question, is this only available to Long Island residents? Barbara or Daphne?
Can I answer that, Barbara? I believe, I mean, we would want you to see, because it's medically supervised, we would want you to come in to see the physician at the first visit. However, now that there's telemedicine, there is that avenue to do things virtually, but I will get more clarification, but I believe that we'd want you to at least come in that first time to see the physician. Then after that, it could be a virtual.
Okay.
Does that answer the question?
We have a couple of questions here now about, do you accept insurance?
The $220 is out of pocket. We do verify everybody's insurance for the copayment, if there's a copayment for the doctor, but we always verify everything and tell everybody upfront what the cost would be before scheduling consults, so that everyone's aware of what the out-of-pocket fee might be. But the $220 is not reimbursed by insurance.
Okay. Another question, does your program include an exercise program? Years ago, I did this and was able to use physical therapy at Mather.
Unfortunately, because of the pandemic, they stopped that program. So hopefully that will resume soon. We're always inquiring about it. That was a great program, but we do discuss exercise at length with patients, and also to try to, meet them where they're at. So we have to also take into limitations, but hopefully we will get that Mather PT program back. That was great.
Okay. Someone is asking, how do I sign up? And I just put the contact information up on the screen. So that should
Thank
answer
you.
that.
Thank you.
And is the initial assessment, including physician exam, only in person? And I think you might have answered that. Yes?
Oh, I'm sorry. I thought yes. I believe, at this point, I know they want to see everybody in person for the first consult so they can really do more of a comprehensive exam.
Okay.
If anything changes, we could get back to between the televisits, but I think they really, because they also examine your abdomen. They do like a physical exam also, so they need the person.
Okay. Someone said they missed the beginning of the presentation. Will it be repeated? We won't repeat it live, but following this webinar, give it a few days, and this and all our HealthyU presentations will be posted on our website. So that will be matherhospital.org/HealthyU. Can you tell us more about the Mediterranean diet?
Oh, sure. The Mediterranean diet, and Barbara, you can help out with this too, has been around for so long, and it's really our centerpiece of the program. It's a diet that consists of lean protein, lots of vegetables, beans, non-processed, a little healthy fats like olive oil. So we just center around that. You want something more specific regarding the Mediterranean diet? Sorry, with the question.
We do, I want to say we do a whole class on the Mediterranean diet where we offer sample meal plans at the end as well. And you will get a sample meal plan from Daphne if you start, that is around, which features the Mediterranean diet.
And we also have a beautiful booklet with the portions of the Mediterranean diet and just lots, like Barbara just said, lots of recipes and recommendations. And the recipes, we're very lucky. We have one of our support people, Donna, that you'll be talking to if you call the number on the screen, that really comes up with lots of recipes, which people love.
Okay. Another question. I'm already scheduled for a gastric sleeve in late February. However, I never was given this option of weight loss, particularly interested in the metabolic analysis. Should I postpone the surgery and do this program?
I would talk with the doctor regarding your surgery, because that's something that has to be very individually talked about. I can't give a general answer to that, unfortunately, because I don't know the whole story.
Okay. When does the program start?
The program is it's a revolving classes. So you can jump after you have your consults and you meet with the doctor and have your assessment with the doctor, then we will enroll you in the classes. But again, you might come in, it could be someone's 10th class, it could be your first class. So the classes keep rotating.
Steph, I don't know if we mentioned that the classes are held for medical weight management every Wednesday at 11 and 6. And then the program is on Tuesday at 12:30 and 5:30.
Thank you, Barbara.
We should have put that in the slide.
Yes, that's okay.
Another question, is it clear upfront as far as separate billing from the physician who performs the patient exam?
Yes, we will tell you what the copayment is prior to you coming in to see the physician. Not the copayment, we will verify your insurance, but if there's any like out-of-pocket fee, but it would be your general copayment. And sometimes some insurance, there's no copayment, but we don't do the insurance. We have someone verify the insurance, but we will call you before and tell you upfront any type of out-of-pocket fee in addition to the $220 that you pay for the program.
Okay. Another question, would you accept people with under 30% BMI?
Under 30 BMI?
Yes.
Yes, because if you had a 27 BMI and had any of those comorbidities, we would accept. And also, sometimes there's exceptions. You could always call the office and we would talk to you one-on-one to see what's get more detail. But because it's medically supervised, that's the parameters that we use right now.
Okay, I'll give it another minute, see if there are any other questions. Okay, I'm not seeing any other questions. So I just want to thank our presenters again, Barbara and Daphne, and
Thank you.
thank all of you for taking part in this webinar. Again, if you think of a question that you have, you can always email it to me at matherhospital@northwell.edu. Thank you all and have a good afternoon.
Thank
Thank
you.
you.